Lithotripter, a detailed report. Number 1. Introduction. Kidney stones and urinary tract stones are one of the most common urological problems worldwide. Traditionally, treatment required open or invasive surgery, which carried significant risks and long recovery times. The development of the lithotripter revolutionized the treatment of urinary calculi by allowing non-invasive or minimally invasive stone fragmentation. Instead of surgically removing stones, this device uses focused energy such as shock waves, ultrasound, pneumatic pressure, or lasers to break stones into smaller fragments that can pass naturally through urine. Lithotripters are now considered a standard of care for urinary stone disease and are used globally in hospitals and specialized urology centers. Number 2. Definition. A lithotripter is a medical device designed to fragment calculi stones located in the kidneys, ureter, bladder, or bile ducts into smaller pieces using energy waves. These fragments can then be expelled naturally by the body, reducing or eliminating the need for surgical removal. The word comes from litho equals stone, tripter is to break or crush. 3. Types of lithotripters. Lithotripters are classified based on the energy source and method of stone fragmentation. 1. Extracorporeal shockwave lithotripter, ESWL, works from outside the body, extracorporeal. Uses focused high-energy shock waves directed at the stone, most common and non-invasive type. 2. Intracorporeal lithotripters require insertion of an endoscope into urinary tract. Laser lithotripter, holmium YAG laser, uses laser pulses transmitted through optical fibers to fragment stones. Highly effective for all stone types and sizes. Ultrasonic lithotripter produces ultrasound vibrations at the stone surface, breaking it into dust or small fragments. Pneumatic lithotripter works like a tiny jackhammer, delivering mechanical shock waves via compressed air. Electrohydraulic lithotripter, EHL, creates spark-induced shock waves inside fluid medium directed at stones via an endoscope. Number 4. Parts of a lithotripter. The design of a lithotripter depends on type, but common components include shockwave energy generator, produces the shock, laser, or ultrasound energy. Focusing system, concentrates energy waves precisely on the stone to avoid damage to surrounding tissue. Patient table couch, supports patient in correct position during procedure. Imaging system, X-ray fluoroscopy or ultrasound for stone localization. Coupling system, water bath, gel, or cushion medium that allows energy waves to transmit into the body. Endoscopic probes, fibers, for intracorporeal lithotripters used to reach the stone directly. Control console, allows operator to adjust intensity, frequency, and number of energy pulses. 5. Uses. Lithotripters are used in urology and gastroenterology for stone management, kidney stones, renal calculi, ureteric stones, stones stuck in ureters, bladder stones, biliary, gallbladder or bile duct stones, less common but possible with specialized lithotripters. They help avoid surgery in 80 to 90% of stone patients, depending on stone size, type, and location. Number 6. Precautions. Before using a lithotripter, precautions are necessary to ensure safety. Patient selection. Stone size usually 2 centimeters for ESWL. Correct location must be confirmed by CT scan or ultrasound. Contraindications. Pregnancy, risk to fetus. Bleeding disorders or patients on anticoagulant therapy. Severe obesity or skeletal deformities may affect targeting. Untreated urinary tract infection. Before procedure, patients may be advised to fast. Hydration encouraged afterward to flush fragments. Monitoring. Careful supervision for patients with cardiac pacemakers. Use imaging guidance to avoid hitting surrounding organs. 7. Key features. Non-invasive or minimally invasive treatment. Precise targeting using X-ray or ultrasound. Adjustable shock wave intensity and frequency. Short duration procedure, 30 to 60 minutes. Can be performed as an outpatient in many cases. High stone clearance rates, especially for small to medium stones. 8. Advantages. Avoids major surgery and surgical complications. Minimal anesthesia required, local sedation or light general anesthesia. Short hospital stay and recovery period. Can be repeated if necessary. Less scarring and trauma compared to open procedures. Cost effective in many cases. Number 9. Risks and complications. Although generally safe, lithotripters can cause hematuria, blood in urine, usually temporary, pain or discomfort during passage of stone fragments, bruising or skin irritation at shockwave entry site, residual stone fragments requiring repeat sessions. Steinstrasse, stone street, fragments blocking ureter. Urinary tract infection, rare, kidney damage, hypertension, or decreased kidney function if used repeatedly or improperly. Number 10. How to use. Procedure outline. 1. Patient preparation. Patient lies on the treatment table. Sedation or anesthesia administered depending on type. 2. Stone localization. Stones identified using ultrasound or fluoroscopy. 3. Coupling. Gel pad or water bath applied between machine and patient's body for shock wave transmission. 4. Energy delivery. Shock waves, laser, ultrasound delivered in multiple pulses, 1,000 to 3,000 per session. Procedure lasts 30 to 60 minutes. 5. Fragmentation. Stone breaks into small pieces or dust. 6. Post-procedure care. Patient advised to drink plenty of fluids. Pain medication may be prescribed. Follow-up imaging to confirm stone clearance. Number 11. Conclusion. The lithotripter is a revolutionary device that transformed the management of kidney and urinary tract stones. By replacing invasive surgery with non-invasive or minimally invasive procedures, it has significantly improved patient comfort, reduced recovery times, and lowered healthcare costs. While it carries some risks, its benefits outweigh complications when used appropriately. Proper patient selection, skilled operation, and post-treatment care are essential for successful outcomes. Thank you. Have a nice day.